Thanks for tuning in to Vital Motion Podcast. Let this be a place to grow your mindset and prioritize movement. All audio is original with music and production support from Riverside as my editing platform. This podcast is for education, inspiration only, and any studies or products I mention are simply for context. Take what fits into your life and check in with your healthcare medical providers as you feel is necessary. Thank you so much, and I'd love for you to like and subscribe to my channel. Happy listening. Hello, everybody. Welcome back to another episode of Vital Motion Podcast. I'm your host, Maddie, and today we're joined by two guests, Tori Jones and Kaylee Waldron. I'm in PT school with both of them, and yeah, we're just going to have a little conversation today about some various topics regarding like sports psych and sport injuries and all those things. So without further ado, Tori is going to tell us a little bit about herself first.
All right, hi everyone. My name's Tori. So I have my undergrad in exercise science from ODU, and I'm currently in the doctorate of physical therapy program there. I decided to do PT because when I was in high school, I actually ended up fracturing my back. And then I had to do like PT for like 6 months. But the therapist that I had was so great. She also used to be a dancer. And so she made like our exercises very dance based, which is really cool. So I was able to come back like stronger and better than ever after my injury. But yeah, that's me.
Nice. Awesome. That's amazing. I didn't realize that you broke your back. So I always
Yeah.
like to learn new stuff about people, and that's cool that, they were able to relate it to dance. And then next, Kaylee is going to introduce herself.
So, very similar to Tori, I also got my bachelor's in exercise science at ODU and currently in the DPT program as well. I kind of always knew I wanted to be in healthcare, and I was always like really creative growing up. So I was like, oh, like a career that can kind of combine the two. And I loved the gym, so it's kind of a little bit of everything. And I feel like the profession you're actually allowed to be like personable and see your
Mhm.
patients. And then I got to watch my dad go through PT and how they like catered it to what he wanted. And then I went through it as well. Did not like my PT. And I was like, okay, I think I want to do this so I can do better.
Yeah, definitely. Having personal experience can make this profession attractive to go towards because you're just helping people get back to their best life. So I love that.
Mhm.
Okay, so the first question that we're going to kind of dive into is some common injuries that you guys would see in the sports that you played.
My sport's probably really different, and a lot of people might not even consider it a sport, but I could go on about how it is like forever. But I have grown up bowling competitively. Like my dad has his professional card. Like my parents met in a bowling alley. I was born and raised there. So people are kind of like, it's not really a sport. You can't really get hurt. I have watched my dad rupture his bicep, proximally got it surgically fixed, and then ruptured it distally. There's also a lot of like hand injuries that you see. Like I've seen an abundance of trigger finger, which is basically like the tendons get irritated and the pulleys of your tendons of your finger can't function properly, and then you kind of get stuck in the bent position just from like the gripping. Because bowling, you kind of have to like you have to grip the ball and throw it different ways. And there's a million different ways to bowl, so everybody has like their own little quirks. And then like carrying a heavy ball and twisting your body and stuff. Like there's a lot of back injuries, wrist injuries. I had a weird injury where I couldn't use my right hand at all after years of bowling, which I think looking back at it was just genetic that my bone was too long and it was just not fun. But and then also you can see a lot of like tennis or golfer's elbow just from the strain and the repetitive like flexing and gripping of your arm.
There's such an array of injuries there. Have you ever like seen anybody in the clinic from a bowling injury?
I have not. I can't say that I think it would be very common. I think it's only common for me because like the bowling community, I don't know how to explain it if you're not in it, but there's like thousands of people who are if they're in bowling, like they are a bowler die hard, and it's just like a massive community that you see all the time. So I think I am like used to the injuries of the sport being that way, but I don't think I've ever seen any in like a real life scenario, like outside of the bowling world.
I get that. No, but wouldn't it be so cool if you became a physical therapist on a like at a bowling alley?
I've talked about it. There is a bowler who opened up his own chiropractic practice, and I've seen him sometimes. He goes to like the professional tour stops when they come around here, and he adjusts people. Or if people are in pain, he'll adjust them. And everybody's like, "What if you just open up your own clinic and like gear it towards bowlers?" I'm like, "That'd be so sick."
Yeah, that's such a niche thing, and people would eat that up. So I
Right?
love that. That's definitely something cool to consider. So, Tori, for you, tell us about your sport and what injuries you typically would see.
So with my sport, it's a lot more since my sport's dance, but so since it's a lot of like lower extremity injuries, since there's a lot of more like jumping, like high impact type of like landing when you're dancing and stuff. So but like the main one we usually see is like ankle sprains, just from like landing wrong, that kind of thing. And you can also get like tendinopathies, like especially like Achilles tendonitis and those kinds of things. And then it kind of like all kind of moves up the chain too. So you can also have like hip like labral tears, impingements, even like low back pain. Like obviously I had my injury to my back, which was kind of like an interesting injury that I had. So it was like what the doctor said was it was a gradual like rotation motion. So like when you're dancing, you do a lot of turning and stuff. And if you don't have the right like core strength and like balance, you kind of compensate in other ways. So with me, I have a really bad like anterior pelvic tilt. So my back is always in a lot of like hyperextension, which I think also played a part in my injury. But basically like the muscle, like my quadratus lumborum, I'm pretty sure is the one that did it, was on my like L3 transverse process. It was almost like a compression kind of fracture, is what they said, I think, from my muscle just kind of pulling on it. But yeah, so like I had that kind of injury for me. But it's really mostly like ankle sprains and stuff like that.
Yeah, when one of our other classmates was on, she was talking about because she used to be a dancer too, and just like the core strength is just a huge thing, I think, for a lot of athletes in general. And you just
Hmm.
put your body in such these like almost like funky positions.
Yeah.
Like over time, it can definitely lead to like chronic injuries. Me personally, being like a gymnast and in the cheerleading world, I feel like very similar in terms of like ankle sprains, low back injuries like the
Hmm.
pars fracture often the
Hmm.
vertebrae, concussions, I'm trying to think of anything else, maybe like occasional broken arm or anything like that. I actually remember one time I was at a state meet and this girl was doing her floor routine and she was doing like a split and she got stuck because I don't know if she didn't warm up before and so she ended up like pulling her hamstring and I felt so bad
Oh
for her because
God.
she was just like stuck in the position, like the
Yeah.
EMS had to come on and like help her out of the position. It was bad. Moving on to the next question, we're gonna talk about maybe some common injuries that you see in like younger athletes and maybe any reasons why.
So I would say I personally I would think that the most common thing is between growth plate irritations or overuse injuries, which we'll kind of get into in another question later of why that happens. But the overuse, like the shin splints or Osgood-Schlatters, and just kids don't want to stop, like especially like the younger athletes, they just want to keep moving. They don't know their body's limitations yet, so they're going to constantly overuse things or not have enough rest on their growing bodies for the
Hmm.
body to recover after doing such strenuous activities.
Yeah, definitely. And Tori, what did you find? I think you did it more specific towards dance, right?
Yeah, mine was more
Okay.
like, yeah, dance specific, but it's kind of like the same thing I said for like
Yeah.
the last question. They're kind of similar, but I also agree with what Kaylee was saying too, just a lot of like overuse injuries.
Definitely. And a lot of kids are pushed now into more travel leagues at a younger
Hmm.
age. And so they're just doing more on their bodies early on. And I feel like just leading to more burnout at
Yeah.
a quicker pace versus if, they were waiting till like late middle school, high school to specialize in a sport. So
Hmm.
I think that can also be a part of the issue. And so then what are some common signs that you may see if like an athlete is returning to sports following an injury too soon?
So I feel like quickly fatiguing or noticeable compensation should be like
Hmm.
major red flags. So like if their injury was not fully recovered, their body's going to compensate in some other way to guard that painful area, especially with like concussions. So like during my clinical, I got to do like a lunch and learn on concussions and kind of like the proper protocols and what happens if you don't follow them. And they've done some really cool things now for younger kids, specifically student athletes, where they not only have restrictions from their sport, but they have restrictions from school too. So, like, they go through the process of a doctor and no screen time babying, like introducing assignments, and like they're only allowed to do a specific amount of schoolwork because you're stressing your brain. So like yeah, just really you can tell sleepiness, fatigue, or just re-injuring so quickly.
Piggybacking off of what Kaylee was saying, also if they are like kind of fear avoidance too, like coming back too soon, like trying to do like a move or a trick that they used to be able to do before they got injured and then trying it again, just kind of like psychologically, they're just kind of scared to do it and do it correctly, which could also like lead to like bad form, which can also lead to like more injuries in the future of that, as well as if they're having pain in like that same area, that's an also like a red flag.
Yeah, definitely. Or just like recurrent minor tweaks or like re-injury of the area. If it seems like it's just like maybe not getting better, it may be time to like take a pause, really just give their bodies a chance, like, I don't know, 2, 3 weeks or a month, just let their body heal. But I think that's the tough thing, right? Is because these kids are like, where their parents are paying for them to be in this club or travel team, and they're like, we can't
Mhm.
really stop right now because we're paying for this. So it's kind of a teeter-totter of like, recovery, but then you're also wasting money. So I don't know. It
Yeah.
can be tough, I think, for a lot of parents to make that call. And then, yeah, kind of like feeding into this next topic of just like the mindset, like you mentioned, Tori, just like fear
Mhm.
avoidance. How
Mhm.
important do you think that is for athletes when they are recovering? Oop, whoops, I just turned my camera off for a second. How important do you think it is for athletes when they are recovering and just like their confidence?
So I could bring in like some personal experience. So like when I did like hurt my back, so I went to a high school that was like a dance performing or performing arts high school. So I was in their dance program, and literally at the end of the season, we do like a May dance concert, and I think I fractured it in like April, and so I couldn't dance. And then when I fractured my back, they tried to have me like restart and hold me back a level. So instead of going to ballet four next year, they tried to keep me in ballet three again. So I had to go with them and talk to like the school board and talk to just like the principal and my dance teachers there to tell them like, hey, I injured my back. I didn't forget how to dance. So like I know the technique. I just had to get my body in a better shape. And I guess they thought like ballet four was going to be like too much for me. And I was like, no, I can do it. And then so they advanced me to ballet four and I was able to do it. So just like trying to be like confident in yourself as well. But I also know or remember like when I couldn't dance for like a long time and I couldn't even do like my dance competitions that I was doing outside of school, that took a toll like on my mental health and stuff too. So like I was just like upset. I couldn't like express myself the way I wanted. I was like not doing well in my dance classes at school because of it too, and not being able to perform and just doing what I love takes a, I think that also takes like a big toll on your mental health too and confidence too. But
100%. I
mhm,
feel like a lot of athletes that are in sports as well, like they have a competitive mindset and like a lot of them hold themselves to a specific standard. So like when they're trying to get back into it and they can't do exactly what they want,
mhm,
it's very frustrating. Like I
mhm,
also have personal experience when I had an ulnar osteotomy. So like my ulna bone was too long and it was deteriorating my carpal bones over time. So they shortened my bone. They took like a 3 millimeter chunk out and then screwed and plated it together. Bone, once bone heals, especially if it's screwed together, like I can't re-break it. You obviously could, but it would take like some heavy trauma. When
mhm,
I got out of my surgery, and it was like 6 months after, so my bone was healed. I could not fathom in my mind that I was okay to use my arm because I went a whole month not able
mhm,
to lift heavier than a pound. And then I went straight to PT where like in the gym I was doing clean and jerks prior to my surgery and stuff. And she like put a bar in front of me and she was like, do it. She's like, I promise you you were able to do it. And it took so much out of like my mental to force myself to get back into it and be like, okay, my body can handle this. I feel like it just takes time with that as well.
Definitely. And I think like we have to be a good front line, especially if we are treating athletes, to encourage them and motivate them because, we're kind of like their first line of defense in like returning to activity. And so we have to really be motivating, make it fun,
mhm,
and, kind of relate it to sports specific activities so they still feel like they have some self of identity. Because I feel like especially for me when I was an athlete, like that was all I was. Like,
mhm.
you go get home from school and you go straight to sports or whatever the case
Yeah.
may be. So I think it's hard for a lot of athletes because that's all they do, you know?
Mhm.
And if they're not
Um,
seeing like the exact improvement that they want in the moment, like they're gonna feel like they're not getting better, but it's
Yeah.
mhm,
just a time thing.
Yeah.
right.
Patience.
Yeah, and especially like if you see like professional players and they're returning to sport like so much sooner than what a typical timeline is, it's really tough to like encourage your patient when you're like, no, you're right on time, but they're like, no, well, this player went back in 3 months, post-op or whatever the case may be, and you
Mhm.
also have to think like they have all of the resources and all of the time and money to put towards their rehab. And when I was just like researching stuff, it just seems that like, psychological readiness is just as important as like their
Mhm.
strength and their stability and able to handle the load and or the load and
The
force.
Lord.
The Lord. They're able to handle the Lord. No, but just like the load and force and, cutting and changing direction that it takes. And then actually another interesting, well, a fact that I found is that there's only 55% of athletes that returned to competitive sport after ACL reconstruction, and
Mhm.
most of it was due to psychological factors and just like fear avoidance and
Yeah.
not feeling adequate for recovery. So I really have a special spot for them because it's just such a tough rehab already, and it's just really
Mhm.
unfortunate to put all that work in just to like be too afraid to go back to sports. So then the next question that we're going to kind of dive into is, do you think that our athletes are overtraining or specializing too early in age?
100%. Maybe, and obviously, like stuff like this is a case by case basis, but I do feel like overall you see young kids, like I feel like baseball is probably the most common one where kids are drilled into it. Oh, they go from T-ball at like 3, 4 years old, and then they're
Mhm.
going on from then, and then the training just gets worse. And the thing with sports is like, yes, it is totally cool to have your thing, your one thing that you're good at or love to do. But when you are constantly doing like the repetitive motions and like baseball, for example, like it's mostly your arms and your upper body. Sure, you're running, but all the stress is on your shoulders and your elbows and wrists and everything like that. So you don't have variation in your exercises and you're training multiple times a day. I don't know. I just feel like you need some type of break between sports to like, oh, let my body get used to this as well.
Mhm.
Especially when you're growing up and developing and like I mentioned growth plates earlier. If like things like that aren't closed or you're not fully developed, like your body adjusts to those things and maybe not the most healthy manner.
Yeah.
Yeah, definitely. I think just like diversifying, especially when kids are younger, is just going to be the best thing for them developmentally so that they don't have these muscular imbalances or, like you said, like overuse injuries at the age of 10. Like, that's just not good when your body's not even fully, developed. So, I definitely think something to keep in mind and, taking rest breaks in between seasons, not feeling like they have to constantly practice and drill, like do all of these like things off season while they can be beneficial. It's so important to let your kid take some time to recover and just be a kid too. It goes back to just like them also having fun and enjoying themselves too. So we
Exactly.
can't forget that.
I feel like if kids find like a sport that they really enjoy doing, and I feel like it's good to kind of like put in the money and the time and the effort to kind of like expand their talent as long as they're having fun doing it still. I feel like once it gets to a point where they're not having fun anymore and it's just the parents kind of like drilling them and their coaches overtraining them and they start to just like not have a good time, then I feel like that's kind of like pushing the point. So I think if, as long as they still enjoy like doing that, then I feel like it's good to kind of like push them and specialize them into something if they're still, wanting to do that. But if not, I feel like you should need to like take a step back and like talk to them about it again, like with like the psychological components to it. Like talk to your child, see like why aren't they enjoying it anymore and like what can be changed to help them just kind of enjoy it more if they start to not.
Right. And then you got like the high school sports where they're doing like 7 a.m. practices and then again
Mhm.
after school and then meeting on the weekends. Like I feel like football specifically, like they are insane and do all year round. Like there's no way that some of these kids feel like just like a robot at that point. Which if they love it, great for them, but like you also have to keep in mind is their body loving it as well.
Right.
Mhm. Yeah, definitely. I mean, I don't know how many times like people will say, Well, I don't know. It's kind of a mixed bag. Some people are like, I don't regret anything I did as a child, and other people are like, I wish I would have taken care of my body better when I was in my youth. And
Yeah.
part of that is just like, just like maybe an awareness of like the effects later on and how our body changes as we age. So,
Right.
but but yeah. And then what is something that you think that you could do or we could do as future PTs to help motivate not only athletes, but maybe just like patients in general, whatever, you decide to, whatever field you decide to end up in.
So you kind of said something earlier, Madison, about making PT fun and relevant. I feel like that is so astronomical. Like even with a patient that I had, not an athlete, but they were expressing that life just felt like a program and everything was the same. And yes, they knew that they needed to do it, but like they were just tired of the same routine. We have to make like their program so individualized and helpful for what they want to do, not just throwing in very common exercises. Yes, they may help, but we need to tie it into their sport. And specifically with athletes, or just tasks in general, but specifically with athletes, make it relevant to the sport that they're in. It's like when my dad ruptured his bicep, I watched him, they tied like TheraBands to cable columns and he was taking it like he was rolling a ball. Like you can do
Hmm.
so many crazy things to still stress the muscles and joints you need to in a healthy manner.
And I think that's the fun in it, right? Like we don't want to get stuck in this just like, pattern of doing the same thing every time just because we think it works. I feel like we should always just be evolving and changing so that we can best help our patients and make it a fun place to be. Because not only do we have to be there 5 days a week, but our patients see us, 2, 3 times a week too. So
Hmm.
make it worth their time and their money and everything else.
So I agree like with what both of y'all were saying about like making sure like exercises in their rehab program is like individualized for their specific goals that they have and like what they want to get back to. But I also feel like kind of reminding the patient too, like it's okay to take breaks. It's okay to kind of like breathe and understand that like you're not going to get better overnight, that these things kind of take time. But just kind of like be their support for them and just keep reminding them and reassuring them like you are going to get better. It's just going to take time and you just got to be patient with yourself as well.
Education as a PT is so important as well. Like not only the exercises that we're giving them, but like my biggest lesson over clinical was the body is connected. So yes, this athlete might have this very specific injury, but if you're not addressing like obviously injuries can happen from different mechanisms like twisting or bumping or anything like that, but there could also have just been malalignments or muscular
Mhm.
imbalances that slowly led to these things. So if you look at the body as a whole and be like, oh, yes, their knee's hurting, but is it because their hips don't work the way they should? Like, just educating that we need to look at everything to prevent these injuries in the future as well. I feel like the patients feel so much more cared for when you are taking a second to address everything and not just their knee or their wrist.
Mhm.
Yeah, for sure. It's easy to kind of get in like a pigeonhole and be like, oh, they're just coming for their knee. So we just have to treat their knee. But it's really the whole chain. So I agree completely. Did you all get the chance to work with a lot of athletes this summer? If so, how was that experience? Do you think you're interested in that or not?
I think I only got one true athlete, and it was jujitsu, which was kind of different. And it was a foot injury, which I'll preface by saying the foot and ankle is not my jam, only because it is so complicated for me. I don't know what it is. My CI was amazing and challenged me with it. So it was just interesting, like they landed wrong or something like that. And I don't remember exactly if it was a fracture or anything, but it was just so interesting on like the advanced things that you can do once you get them feeling better. And I could see myself working with athletes to an extent. I just feel like doing the advanced work and the exercises that you need to and like stabilization drills and stuff like that takes a lot more effort to think about and make relevant. So that would just take some practice. But I honestly don't know what I want to do. I could be interested in anything at this point.
I worked with like a couple athletes, not like directly, but just kind of like other therapists working with them. And I had one that I did like a couple sessions with. So the first one was a patient who is a gymnast in high school, and they had injured their back, like low back pain. kind of thing, but very like typical like gymnast form, like the very like hyperextended like lumbar spine and stuff. So we worked with him doing a lot of like kind of crazy exercises. They did one which was called like a barbell rollout. So he's like kneeling on like the Air X and then he's like pushing the barbell in front of him using like his core and like posterior chain like muscles to help kind of control everything, just rolling it out and then rolling it back in. I was like, that looks insane, but it's also like creative in a way. I was like, I would have never thought to do that. And I could barely even lift the barbell up. So I was always like, need my CI to come set it up for me because I can't. But that one was interesting. And then we like discharged that one like a few weeks into my clinical. And then another one that we had, which I like kind of like would work with indirectly, they had a an avulsion fracture from his rectus, and it had gone like misdiagnosed, I think, for like a long time, like almost like 6 months, I think, or to a year, that kind of time frame. So and then now they've just been working on just getting his like quad strength back, and they're also doing like a bunch of like high intensity kind of exercises too, which I thought was interesting. But yeah, so like what I want to do, I also want to work with athletes as well, but mostly dancers. And I feel like that is, at least in like our area, isn't a huge like there's not like dance specific physical therapy places. That's not like just in like New York City or DC or like those major city areas. My fiance has actually been encouraging me to also open up my own clinic in the future, which I think would be cool and like specializing in like dancers. And also, I've been more interested in like hypermobility patients as well.
No, that's awesome. I love that. It's so hard to make a decision because there's so many different routes that you can take in this career. And I think that's just kind of one of the blessings in disguise because, if you get sick of one thing, you can just go and jump into a completely different setting and
Hmm.
try that out for a bit. But no, I think that would be amazing. I feel like any kind of niche work is always beneficial, especially if it's kind of not as common in this area. So that would be really cool to see if that ends up happening for you, Tori, or it will happen
Yeah.
for you.
Yeah.
Trust it. Um, yeah, I think see myself working with the athletes as well. I've also thought about like specialization, like with gymnastics and cheer, just because I have a background in that. But I think I
Mhm.
would really be, I don't know. Like I said, I just love ACL rehab. So I could see myself like
Yeah.
really specializing in that too. And then just to kind of wrap up, any kind of cool things that you learned from clinical that you want to share?
I feel like I kind of already said how like the body is so connected.
Hmm.
That is definitely my biggest takeaway. Like my CI never once looked at one specific thing. Like we were constantly looking at the entire body, the foot, hip, and knee. Like it is a true chain. One can affect the other, but the
Hmm.
one could have came first and the other's affecting the other. I don't think I had like a single eval where there was a true mechanism of injury. Like most of it was chronic and
Hmm.
this pain just developed over time. So kind of learning to look at like gait mechanics and lifting mechanics. How are they getting out of bed if that's what's bothering them? And I felt like the biggest takeaway was glutes are neglected. And like I remember telling an older patient this and they just could not wrap their brain around why we were drilling in on like strengthening their glutes. But like it is
Hmm.
truly a powerful muscle. Fun fact, the glutes and the quads are the quickest thing to go as you age. So really trying to focus in on them and like the glutes do so many motions and a lot of people don't even realize like there's three glute muscles. There's not just the one. So definitely learning how to narrow in on that. And then my CI was specializing in vestibular, so that was kind of cool, but also the PRI, which Madison that stands for is the postural.
Restoration therapy. I think it's Postural Restoration Institute.
Oh, okay, that would make sense.
Mhm. Yeah.
So learning about the PRI stuff was awesome. So like breathing, a lot of people don't exhale completely, like ever when they're
Mhm.
doing things. So their body never fully relaxes, which is a huge thing with neck and shoulder. If you never fully exhale, everything's always up here. So that was kind of cool to see different breathing techniques, very specific exercises to narrow in on like tiny muscles. And a lot of it focuses on the glutes and alignment and stuff like that. Watching people blow in balloons during exercises to like engage their core was kind of awesome. Yeah.
Yeah, definitely. There's so many cool interventions out there that I feel like are so far from what traditionally we may learn in PT school. So it's exciting to explore that. I think that's why I became so, I guess, obsessed with the foot
Mhm.
because the foot is like where everything starts. And if you're not able to extend fully through your big toe in your when you're, walking, you're not going to be able to engage your glutes properly. And so I just think it's just like this constant loop of just improper mechanics over time, and it happens to all of us, but just being able to like, reset and be aware of it is just the most important thing.
So one thing that my CI definitely did a lot of was like desensitization for certain body movements or motions. So like if a patient has trouble with, let's say, like shoulder abduction and they're having like a lot of pain with that, so like their nervous system's kind of like sending these signals to the brain that anytime they lift their arm, it's going to cause like there's a threat there. There's like a reason why there's pain, like and all these signals are going off. So if we work in exercises in a tolerable range, still doing that same motion, it can also help with dampening those nervous system signals that you're getting to help your body or your brain realize, oh no, this isn't a threat. Like I'm able to do this. It's just like doesn't feel that great. But if you keep moving into that, hopefully over time, you'll desensitize your nerves, and then that'll help kind of decrease the pain that you have with that certain motion. So we did a lot of that with like especially shoulder exercises and like reaching overhead and external rotation, like a lot of that too. So I thought that was like really cool and really interesting.
Yeah, no, that is cool. Now I'm thinking about it. One of the things that my CI would do a lot is he would tap the muscle. So, for example, if I don't know, we were doing side step ups, he would like tap their glute med, because the
Mhm.
other issue is like sometimes muscles are just not firing properly. And I tried it on myself at the gym. I immediately
Mhm.
felt it, and like the next day I was really sore. So it's kind of crazy
Oh,
how like we
nice.
just use these little cues and it like makes such a huge difference. One of the things that I learned about Osgood-Schlatters disease, which I don't know if I just missed in class or just kind of this was a good refresher, but basically I didn't realize that the quads can become like, hypertrophic or overgrown basically because of that repetitive pull on the kneecap from running and jumping. And again, it may be going back to like weaker glutes or just not, having those proper mechanics. And so I just thought
Mhm.
that was interesting that if, your kid starts to have like really strong looking quads, but everything else is looking a little weaker or smaller, it may just be time to do some like muscular training in other muscle groups, especially if they're like running and jumping a lot. So,
Mhm.
yeah.
Mm, I definitely don't remember that being a thing in
Yeah,
class.
me either.
Yeah, okay, good. So it's not just me because I was like, because we had an eval come in and it was like hypertrophy of the quads, and I think it had said underneath like Osgood-Schlatters, and I was like, is this like a common thing that you see? And so my CI was like explaining that. So yeah, it's always good to learn something new, and I feel like it's so important for, parents to be aware of this stuff too because they're seeing their kids all the time, and they sometimes it kind of all blends together, but just being
Mhm.
aware of these things so you can get your kids the help that they need. And yeah, well, thank you both for coming on, having conversation today. And yeah, we will see you next time, listeners.
Yeah, thank you for having
Thank
us.
you.